everyone in the loop on what's going on. Hopefully you're getting our emails, trying to keep you up to date on changes in guidance such as masks, as well as there'll be an email going out later today about some leave options and such. So I'll jump right into our presentation. And you can see here, as with past presentations, I want to give you a little update on COVID overall. About a week ago, we were seeing about 980,000 worldwide cases and 50,000 deaths. And in the United States, close to 250,000, 235,000 cases and 5,300 deaths. We're now up to almost 1.6 million cases worldwide and 93,425 deaths and 452,000 cases in the U.S. and 16,000 deaths. So we are seeing a significant increase in both cases and deaths, particularly in the United States. We've talked about this previously, but remember, as the pandemic has spread across the world, some places like Italy got hit harder earlier than us. So we're a little behind them in the surge of cases. New York is ahead of us. We think in California that we've slowed it down a little bit. That doesn't mean we won't expect to see additional cases locally or statewide. We will expect to see additional cases, but hopefully at a slower pace than some of the other areas. So in California, the numbers are as of April 7th, so a couple of days ago. We're a little behind on the California website. As I mentioned last time, we have probably by now over 17,000 cases and almost 450 fatalities in California. That is a significant increase from last week. And in Fresno County, we're now up to 156 cases. I think we had just under 60 last week, and we now have had 3 deaths. Last week, we hadn't had any deaths. We are getting, as our numbers increase, we're getting more demographic data, more descriptive data around those who are sick or hospitalized with COVID. So 29 of the 156 have ever been hospitalized. So what that means is for individuals who test positive, some of them have been symptomatic, some of them have been asymptomatic, and some of them have been hospitalized, but at this point, around 30. We also are getting information about where the cases are. I know I've been asked that question in the past, and we didn't really have enough information to share. And so now that we have as many cases as we have every day, this is also shared on the website, the Fresno County Department of Public Health COVID-19 website. So you can see here through yesterday, and the 156 is through yesterday at 4 p.m. Each day at 4 p.m. that website updates, or around between 4 and 5, we'll say. And so if you're interested, you can go on that website each day in the late afternoon and see any changes. And then it will also describe where those cases are. So you can see the vast majority are in the city of Fresno, about 17 in Clovis. There are 12 cases in Firebaugh. So for those of you who think it doesn't happen in rural areas, that has not been the case in other parts of the world in the United States, and it is not the case in Fresno either. It can happen in rural areas. 7 in Sanger, 6 in Reedley, and then all of those other towns that are mentioned have 4 or fewer cases. When there's so few cases in an area for privacy and other reasons, they won't be specified. But as there gets to be more cases, then it will be shared, just like the overall information has been. The only change on this slide, and this is just Fresno County's response, is some of the changes that I just mentioned and what's being reported out, and also that now the convention center has been identified as the alternative hospital site. It's being set up. I imagine there'll be a media event there in the next couple of days. Hospitals will be going through that site, looking at what supplies and equipment are available there. That will help guide what types of cases might go to the alternative hospital site if needed, and determine how that decision will be made. Likely what we're hearing is that alternative site would be for non-COVID cases, people who perhaps are close to being discharged, but those are decisions that will be made in the next couple of days. So what are we doing? Not a lot has changed on this slide. The things that we have done is we've pretty much finalized being able to equip our at-home staff with equipment to do their work. We will continually prioritize that as we identify additional problems. I know some of you maybe have had problems with Wi-Fi or cellular service, or a phone or that type of thing, a camera maybe. And so each day, each week, we're refining what's available as we get additional supplies in, and as we problem solve for individual problems, we'll continue to work on that. We are doing a employee portal or online screening tool now, so you should be able, for those of you who are coming into work, to go online and complete that screening tool. If you screen in terms of having any symptoms, we would ask you not to come to work. That's pretty clear on the screening tool, so please follow that, and to let your supervisor know. As I said last week, we haven't quite gotten to this point, but I anticipate we'll eventually get to the point where that daily screening is done, even for our staff who are working from home. And the reason we would start screening staff who are working from home is at some point as we progress through this pandemic, decisions will start to be made about if and when some of these restrictions can be relaxed. And that will largely depend on epidemiological surveillance. And what I mean by that is the ability of public health and health officials to understand, not just based on testing and symptoms, because we know we don't have enough tests, or we haven't tested as much as we would have liked to. And we also know that not everyone has symptoms. And so we want to know widely in the community what illness is out there. And so symptoms could help us with that. The other thing we're hoping and anticipating is there are 2 biotech firms in California who are working on a test for antibodies. And that test would be able to detect in each of us whether or not we had been exposed and acquired COVID, even if we never had symptoms. It's believed that if you were exposed to COVID, whether you had symptoms or not, that you're going to have immunity to that. And so those antibody tests would enable us to understand how many people already have immunity to COVID. That, along with our understanding of the positive test and the symptomatic individuals, could be utilized to help guide when, where, and how those restrictions could be lifted. So we do anticipate that we may start screening in some way, particularly with fevers. We are still trying to keep as many people at home as possible, and that could change as we go down the road, and we'll let you know. But if you're working from home now, you should plan on continuing to work from home until you hear otherwise from your supervisor. As I mentioned last week, our warm line is operational. Our call volume has remained relatively low, but we do anticipate as more time passes and people begin to feel the impacts in both emotional as well as financial ways that we might get an increase in call volume. We have seen an increase in call volume in our Central Valley Suicide Prevention Hotline, and some of that call volume we think might benefit from the warm line. So we'll be working over the next week or two to make sure that those individuals are referred to the warm line where appropriate, and we may even have our warm line staff follow up with them. We've done our Facebook Live for the staff and public now. Thank you to Susan Holt, Glera Castro, and Gia Zhang from the Fresno Center for producing those in English, Spanish, and Hmong. And that has enabled us to have now well over 3,000 or 4,000 views on Facebook, which is awesome. Last Friday, we did get new mask guidance from the Department of Public Health. One was what's called an order, and it's telling us that if you work in a clinical area and are engaged in a direct clinical interaction or encounter with a client, that you are to wear a surgical mask. And for staff who are in a clinical area but not engaged in a clinical encounter, you should wear a cloth or homemade mask. And so we've worked hard over the last week to comply with that for ourselves, our staff, as well as our contracted providers. We all know there are massive shortages of personal protective equipment, so we're working hard to both procure protective equipment, as well as to make adjustments in how we deliver care as we work to have adequate equipment. At this point, as I shared in an email that I sent out with you, we do have adequate supplies for county staff who are engaged in that care, but we're monitoring those closely and continuing to order supplies as we anticipate an ongoing need for personal protective equipment. Our homeless efforts are ongoing. We have thus far been able to accommodate individuals who are willing to have shelter in our existing shelters. You may have heard over the last week, it was in the news that one of our homeless individuals tested positive for COVID. There was a lot of fear and confusion and misinformation about that. And we're still in the early days of having individuals test positive. And we're hearing across the nation a lot of stigma and discrimination and really hatred sent towards people who test positive. Viruses are indiscriminate. These people were just unlucky to have gotten it. And so we want to make sure that we dispel the fear and anxiety. So I will tell you that we have a very defined process right now for how we're handling individuals who are homeless who might have COVID. And so we have a system that's pretty well organized where hospital emergency departments, law enforcement, EMS are all aware of it and have been informed. And if they end up with an individual who's symptomatic in an emergency department, then they do the test, they contact our provider who picks the individual up and takes them to an individual hotel room where they are isolated until such time that we have the test results. Once we have the test results, if they're negative, then they can leave or go to a shelter. And when they're positive, then they have to stay in the hotel room for a period of time until public health determines that they're no longer shedding virus. And typically the guidance at this point, and it could change, is that an individual who's symptomatic should not come out of isolation until at least 7 days from when they were first symptomatic and at least 3 days with no symptoms. There's also sometimes additional testing that's done to ensure that a negative test is achieved. And so those individuals are monitored during that time, and they're staying in their rooms. And so the individual who tested positive had never been in a shelter, had only been in the hotel room, and was monitored the whole time. So we have a system that works, and if you ever have questions about that or it creates fear and uncertainty for you, please reach out as much as possible while respecting the privacy of the individuals. I'm happy to share with you the protocol we're using to reassure you that we do have a process. We also have a process where we're monitoring people daily in the shelters, and when they're symptomatic, we're isolating them, and if needed, we would test them. We haven't had to do that yet. But we have a system in place, and that includes access to medical providers via virtual visits, where we can provide some medical guidance and assistance, and we have a federally qualified health clinic that can conduct the test. So we have a good system in place, and again, if you have questions about it, please ask. Just a reminder, there was the order for masking in the clinical areas. There was also a recommendation that if you're outside of your home, if you're needing to go to the grocery store or something, there's a recommendation that you wear a cloth mask. I want to emphasize two things with that. One, a cloth mask, any mask, whether it's a cloth mask, a surgical mask, the famous N95 mask. None of those are a substitute for social distancing, washing your hands, not touching your face. We don't want to create a false sense of security that simply by wearing a mask you now can socialize with other people or not worry about washing your hands. Those are the main requirements when we're trying to mitigate spread. The mask that you would wear at this point under the general recommendations of public health is so that if you have COVID and you are asymptomatic and don't realize it, that your mask covering your mouth would prevent you from shedding virus onto someone else. That's the reason to wear the mask. And so That's a general recommendation. It's not a requirement. I will tell you, I'm wearing a cloth mask when I'm out and about in the community. It is very difficult to have a cloth mask on. It's not a lot of fun. Any mask is not a lot of fun. They become uncomfortable. We fidget with them even though we're not supposed to. I would just encourage you that if you can follow the rules and stay at home as much as possible and not have to wear the cloth mask, that's the best. And then if you have to be out in the community, please don't go in the community, even with a mask on if you're symptomatic. And if you're not symptomatic and you're going to wear a mask, take care to review the guidelines that I sent out, and included in there was guidelines on how to wash that mask regularly. The masks should be made out of 100% cotton, and that cotton should be able to be washed in hot water. And so there's some detailed instructions if you have any questions about that. My usual, stay home if you're sick. I don't know how many times I can say this. We still are occasionally getting individuals who want to come to work sick. Please do not come to work sick. This will be a problem for you and for us if it continues. We are continuing to send out information. Hopefully you've gotten those from me, and we will keep you updated regularly. I've already went over our homeless, so I won't go over that anymore. And do you have any questions? There's usually a little bit of a delay here, so we'll give you a few minutes to see if you have questions, and I'm happy to answer them for you. If no one has any questions, I will reiterate that you are more than welcome to ask questions after this session. Anytime you have a question, please reach out to your supervisor. If they're not available or not able to answer it, feel free to reach out to myself, and I will be sure to find you an answer if I don't know it myself. All right, we're not getting questions. Either I'm doing a really good job, or you guys are tired today, or I don't know. Anyhow. All right, well, this was a short and quick one. I will continue to schedule these weekly sessions. In a couple of weeks, we had a regular all-staff meeting scheduled. So I would like on that day to try and shift the focus away a little bit from COVID-19 and our response, and hopefully start updating you on some of our routine work. I'm going to be frank with you, it's been hard through this pandemic crisis emergency to pay much attention to regular work for me, as I'm sure it is for you. It's critically important, though, to ensure that we continue to provide services to the people who need us, that we do focus on our regular work. Since I took all that time to talk, we have a question, so I'm going to take a question.
How would people get the antibody testing?
There was a question about how would people get the antibody testing. That's a great question. It doesn't exist yet, so there's no way right now to get it. But there are, as I mentioned, 2 biotech firms working on that. And so the things that they're working on right now is testing the ability to get the test. So they're looking at the blood of people who have had COVID and people who have not had COVID, identifying what those antibodies are, and then developing a test that would be able to detect those antibodies. This is a virus that we are learning about each and every day. So most viruses that we are familiar with are different than this virus. So for instance, most viruses, we tell you that you're only contagious when you're symptomatic. But the reason the masking recommendation came in place is because it's emerged through research and science over the last few weeks that we think people are shedding the virus when they're asymptomatic. And so the antibody test, part of what they have to look at is, does having the antibodies afford you immunity? How long does that immunity last? So that if we do a test, we know what that means. Another question.
Will there be a point of contact for county employees who are symptomatic? Do they call their doctor? Do they go to the hospital for a test? Want to make advanced plans just in case?
Okay, so there was a question about whether or not, what should you do if you become symptomatic? I'm going to try and repeat what I've heard the public health officer say in many joint sessions I've spent with him. If you are symptomatic, you should treat it like any other virus, and you should go home and you should take care of yourself. Knowing whether or not you have COVID does not change the treatment at all. Right now, with where they're at with testing, and this will change, so I'm going to tell you two things. Where they're at with testing right now, they're still only testing symptomatic people with priority given to people working on the front line of the pandemic. So you might be symptomatic, you might call your doctor, and they might not test you. In fact, they likely will not test you, or they might test you. It's kind of a variable there. If you're so sick that you need to go to the hospital, it's possible you'll get tested, but they'll screen you first to determine if you are sick enough to be admitted or whether or not you need to be tested. If you're concerned about your symptoms, of course, we would recommend that you contact your own private physician and let them help you decide what next steps are. But what the public health officer is still recommending is that you simply go home and take care of yourself like you would with any other virus you might catch, a cold or a flu, etc. And that for most people, that's all they'll need to do. And then if your symptoms worsen, and the symptoms that we're most concerned about is shortness of breath or a fever that you can't reduce with over-the-counter medications alone. So if you've been sick and you have a fever and you take medications and your fever comes down and you feel kind of not so great, but you're doing okay, probably staying home is all you need to do. If you have a fever, even if it's coming and going, but you can't keep it down with over-the-counter medication, that's the time that you would really, it would be imperative that you contact your doctor or the hospital to get care. But that's basically what the advice is today.
How should PTO go about conducting new investigations? We can only do so much getting information via phone call.
This is a specific question about the Public Guardian Office investigations, and the question is, how do we go about conducting investigations when there's only so much we can do via the phone? For each of our areas, there's going to be decisions made, sometimes blanket or area-wide, and sometimes case by case, on when we need to have interaction with the public. So we still have interaction with the public in many areas of our department, both county-run as well as contractor-run. And I'll give you some examples of those areas. We still have clients coming into the Heritage offices and the Metro offices. These are individuals who are getting care like medication injections and that type of thing. So if it's determined that you need to have an interaction with a client, the things that we would say to you are, as much as possible, maintain that social distance. Of course, we would want you, as is being advised with clinical encounters, to have a mask on, possibly have a mask for that individual as well, perhaps some additional equipment if you're touching belongings and such. So that would be the type of thing that you would really have to take on a case-by-case basis, both in terms of, is it needed? Are you not able to do your job without an in-person visit? And if you have an in-person visit, what protections should we put in place to protect you and the person that you're interacting with? So I'm more than happy to get the Public Health Department involved and assist in making those determinations on a case-by-case basis. All right, we don't have any other questions, so I'm going to let you have the rest of your afternoon. And we continue to work really hard. I really appreciate all of you. I know this is really a challenging time. I think that we're getting into a little bit of a groove in terms of the new normal, but there will be occasional issues that occur, and we ask you to please be patient and work with us as we work to make this work for you and for the people we serve. So thank you and have a very